A 3-year-old patient presents for a seizure that occurred at home. To her father's knowledge, she has never had a seizure in the past. She was not ill at the time of the seizure, and she is not on any type of medication. There was no head trauma before the incident. Her father states that her older brother was diagnosed with epilepsy at age 7, and that his grandmother was also epileptic. Is it safe to assume that this child is also epileptic? A. No, epilepsy is not hereditary, and must present with a history of at least 2 seizure episodes before diagnosis. B. Yes, epilepsy is defined as seizures in the absence of fever, head trauma, or medication. C. No, a diagnosis of epilepsy requires 2 or more seizures without a clear provocation. D. Yes, she has a positive family history for epilepsy, and has had a seizure with no clear provocation. The answer is C. No, a diagnosis of epilepsy requires 2 or more seizures without a clear provocation. While epilepsy may certainly be hereditary, the diagnosis of epilepsy requires the occurrence of at least 2 seizures during 2 separate incidents, regardless of positive family history. These must occur in the absence of provocative factors such as fever, head trauma, or medication. Which of the following is not a form of generalized seizure? A. Tonic-clonic. B. Complex partial. C. Myoclonic. D. Atonic. The answer is B. Complex partial. Generalized seizures are defined as seizures in which both hemispheres of the brain are affected by seizure activity from the onset. There are 4 main types of generalized seizures: tonic-clonic, myoclonic, atonic, and absence. All of these result in loss of consciousness and may or may not cause spasm or clonus. Complex partial seizures, while also resulting in a loss of consciousness, are restricted to one hemisphere of the brain. What is the most common type of seizure in adults? A. Myoclonic. B. Nonvoleptic. C. Simple partial. D. Tonic-clonic. The answer is D. Tonic-clonic. The most common type of seizure in adults is the tonic-clonic seizure, also known as grand mal. These seizures have 2 stages: a tonic stage, characterized by muscle stiffening and rigidity, followed by a clonic phase, characterized by jerking and twitching of the muscles and the face. Some individuals may have a tendency to have more tonic symptoms or more clonic symptoms, or may go in a tonic-clonic-tonic pattern of alternating rigidity and jerking motions. Individuals in a tonic-clonic seizure experience loss of consciousness and may experience headache, lethargy, confusion, or may want to go to sleep on recovery of consciousness. Which of the following is a term for total absence of sense of smell? A. Hyposmia. B. Dysosmia. C. Anosmia. D. Hyprosmia. The answer is C. Anosmia. A total loss or absence of sense of smell is called anosmia. It may be caused by a wide variety of medical conditions, including trauma to the head, stroke, nasal blockage, various dementias, viral infection, toxic exposure, autoimmune disease, or zinc deficiency. Hyposmia is a state in which sense of smell is reduced but not absent, while hyprosmia is an increased sensitivity to smell. Dysosmia is an alteration in the perception of smell which may include olfactory hallucinations or distortions. Which of the following is a condition of reduced sensitivity to taste? A. Ageusia. B. Parageusia. C. Dysgeusia. D. Hypogeusia. The answer is D. Hypogeusia. Hypogeusia is a condition of reduced sensitivity to taste. This may be due to various causes, including brain injury, viral infection, zinc deficiency, certain medications such as chemotherapeutic agents or antibiotics. Dysgeusia and parageusia both describe alterations in the perception of taste. These conditions can have similar etiologies to hypogeusia. Ageusia is the total absence of taste perception.